Hey, this is Dr. Green, and in this video we're going to go over passive range internal rotation holds and lifts for the hip. So to start, we're going to start in the 90-90 position, and we're going to start just with the holds. So passive range holds means that we're taking the hip into passive internal rotation to start. In this position, if you can be a little bit upright, that's great, but if it starts to get a little bit pinchy in that hip, you can lean out to the side to be able to put the hip in a little bit more of a neutral position if it's more comfortable. That's totally fine. Dr. Joanna has good hip mobility, so we're going to have her a little bit upright just to do this. So passive range, internal rotation at the hip. The first part is the hold, so what I'm going to do is I'm going to ask her to contract the muscles in her hip to be able to hold her foot in that position as I remove the block and then replace it. The big thing that we want to make sure that we're seeing is that all of that muscle contraction is happening in the hip and not kind of like getting extension or rocking forward of the hip to be able to hold that leg up. So as we do it, she's going to engage those muscles, keep the core tight. I'm going to pull away, and there's no compensatory movement as she lifts and holds, okay? Now the lift off is going to be a little bit different. We're going to start from a neutral position with the leg down. And then from this position, she's essentially going to do the same thing, but she's going to lift it off the ground to get good internal rotation at the hip without letting that pelvis kind of rock forward or letting the back extend to be able to make up for that motion. So core stays engaged, and then she's going to lift that foot off the ground, hold, and then slowly bring it back down. Slow, controlled, and then for a few repetitions to really feel the muscles in the hip forcing or kind of working into that internally rotated position. So these are passive range internal rotation holds and lifts, which can be really helpful for improving your hip mobility.